that I place an NG tube. I'm going to assess the physician's orders, the MAR, and I'm going to assess the type and why the patient is getting the NG tube. First, I'm going to grab all my supplies before I go into the room, and then I'll go into the room. Hi, my name is Rachel. I'm going to be a nurse today. Your doctor has ordered that I place an NG tube in for decompression. First, I need 2 identifiers. Would you mind giving me your name and date of birth? I'm going to check that against the armband. Thank you. And I have to ask if you have any allergies. No allergies? Okay. I'm just going to take a look in your nares and oral cavity, checking for any deviations or anything preventing me from placing the NG tube on either side. Next, I'm going to first start off by measuring how far I need the NG tube to go in. So I'll take the NG tube, I'll measure from the tip of the nose to behind the ear, down to the xiphoid process. And I'm going to mark that by placing a piece of tape around the tube. And then I'll leave that on its package right here. Next, I'm going to apply clean gloves. I'm also going to get the lubrication for the tube ready. So I'll take this lubrication and just apply it to the packaging right here. At this time, I'll also place a towel over the patient's chest just to protect them. Alright, and then I'm going to allow the patient to ask any questions, and then I'll let them know that I'm going to start the procedure. I'm also going to hand the patient an emesis pan and a cup of either ice chips or water so that when they swallow, it will help advance the tube down. Alright, so I'm going to start the procedure. I'm going to lubricate the tip of the NG tube. I'm going to ask the patient to extend their head back against the bed, and then I'll start advancing, asking the patient to swallow as I advance. If I feel any tension, I'll stop or pull back a little bit. If the patient starts gagging or coughing, I'll stop and pull back. If that persists, I'll pull all the way out and start over. So I'll keep advancing. And then I'll ask the patient if they can tilt their head forward to help with the insertion of the tube. Once I get the tube all the way into where I've marked, I'm going to temporarily tape so I can assess for placement. I'm going to take my pen light and assess the nares and the oral cavity for any coiling in the back of the throat, which I see none. Alright, and then I'm going to assess for placement. Or first I'm going to secure the NG tube with more tape, and I'm going to secure the NG tube to the patient's gown. I'm going to clean up the area. I'm going to ask the patient if they can speak. I'll ask the patient if they feel fine breathing. I'm going to also, if the hospital policy, I'll aspirate for any fluid and test the pH, and then I will attach the NG tube to the bucket and hook it up to either intermittent suction or low suction, whichever one the doctor has ordered. I will also go document what I've done, how the patient tolerated it, how many attempts it took me, the color and consistency of the fluid coming through the tube. Also, I will document the size of the tubing and how far I put in the tube. Next, the doctor has ordered that I aspirate and flush So first I'm going to come into the patient's room and let them know what I'm doing. I'm going to unhook the tubing from the wall and clamp it off. Then I'm going to take a 30 to 60 cc syringe, and first I'm going to wash my hands and apply clean gloves. And then I'm going to take the syringe and I'm going to aspirate any fluids or air from the stomach where the NG tube is placed. And then before I push back the fluids in the stomach, I'm going to listen to see for placement. And I should hear a whooshing sound in the left upper quadrant. So then I'm going to unhook my syringe. I'm going to draw up 30 cc's of normal saline. And I'm going to flush it through the NG tube line. And then I'm going to draw it back up. Going to unhook the saline syringe and place the fluid I just drew back up in a different pan. I'm going to hook the suction back up to what the doctor has ordered. I'm going to ask the patient if there's anything I can do, and then I'm going to document the color, consistency, odor, and how much fluid I drew back up. I'm going to document how the patient tolerated it, and I'm going to date the initial.